Are you completely lost, suffering from foot drop, unable to lift your foot, tripping, and don't know what to do because doctors and physiotherapists don't know how to help you? Well then, this short video will be able to shorten this path and your journey towards the best treatment for foot drop syndrome. If you are here, you are probably one of the three main types of patients: the one who started losing strength overnight and doesn't know why, or you underwent knee surgery, hip surgery, or had some procedure, and then you lost strength in your foot, or you had an accident with a hip fracture, a knee fracture, and then, after resolving all those accident-related issues, you notice that your foot is down and not lifting. What do these three patients have in common? It's that all three need treatment. If you are one of them, stay in this video until the end, because it's really worth it. And it will help you a lot to get a better result from everything you are going through. In addition, we will give 3 extremely important tips so that you can achieve the best outcome from all of this. So, stay until the end. First of all, if you are the patient who, from one day to the next, started losing strength in your foot, it is extremely important that you have a diagnosis. Most cases are due to compression of the fibular nerve, which wraps around the knee and causes you to lose that strength. If you haven't had an accident, if you haven't had surgery and started losing movement, go. Go to a specialist right away. You need to conduct an investigation and find out why. If you have already done this investigation, there is nothing more to do. Or a procedure has already been done, your foot has dropped, you are similar to the other 2 patients who... Let's now talk about those who have had surgery or an accident. First of all, and tip 1, which doctor should you consult for this follow-up, this treatment for drop foot syndrome? The specialist in peripheral nerves, which is my case, and the foot and ankle surgeon, who is the doctor that performs procedures on the foot and ankle and understands this area well too. So, tip 1, seek the right specialist. How will I know if that orthopedist is good if I went to them and they said it's pointless? So, to begin with, if the doctor said it's pointless and that you'll stay that way, probably that doctor is not good. So, seek another specialist. Because there's no way to treat something you don't believe in. So, if that doctor said it won't help, they are not good. They won't help you. And believe me, most of the patients I treated, the treatment for drop foot syndrome went through doctors who said it wouldn't help at all. The surgery. Forget that, let that information go in one ear and out the other, because you can indeed improve with some tips that can help you understand that he is a good doctor. Is the following: he recommended the use of an orthosis to you. So if he was concerned that you use an orthosis, he probably understands the subject. If he explained that you cannot do exercises that involve pressing down to strengthen the calf as well, he probably understands drop foot syndrome and he is helping you with something else. If he told you to stretch the heel, he also understands the problem. If he told you that it will get better on its own, that you just need to do physical therapy, that you don't need to use an orthosis, that it's just like that, didn't request any tests and said that's how life is, then he doesn't understand. Seek another doctor. You need someone who understands to accompany you from the physical therapy part to the medical part. If you heard from a doctor that nothing would help or some absurdity that left you unmotivated, comment below so that other patients also understand that this is normal. They do say these things, and unfortunately we have to overlook it. Alright, so you found a doctor who has already guided you. The use of the orthosis has already guided some exercises, has already told you what you can and cannot do, requested tests. And now you are secure in this part. Now let's move on to rehabilitation. A good physical therapist. It's no use just wearing an orthosis and waiting for the foot to get better. The foot won't improve overnight. You need to achieve each movement. So a good physical therapist is essential. What do I recommend in this case? Call the physical therapist or the place where they work and ask, do you treat foot drop injuries? Have you had any patients with this condition? If they say yes, great. Schedule an appointment. If they say no, go ahead and book with someone else because they probably don't understand. And a physical therapist who knows what they're doing is extremely important for you to have a good recovery. I once had a case, a patient who went to a physical therapist and the only movement she had was pressing her foot down. And then the physical therapist said he understood, and she went there and did physical therapy for several months. In this physical therapy, he asked her to push down, added weight, and pulled her foot to stretch it downward, and guess what? What happened? Exactly, her foot was so far down that I couldn't even lift it, even using force with my hand. You might have seen a video of her on my channel, on YouTube or Instagram, where she is the patient who ended up walking on tiptoe. Not because of a lack of strength to lift, but because she no longer had the heel to pull the foot up. I had to perform surgery to release the heel because she underwent incorrect physical therapy. Imagine if she had done the heel stretching, had undergone proper physical therapy, and followed all the guidelines I provide here for you. From the beginning, she would have avoided surgery, she wouldn't have needed to undergo 2 surgeries and worsen her condition. Therefore, understanding who the doctor is, who the physical therapist is, they are doing the right things based on everything you will see in this video until the end. It is extremely important so that you don't have to keep going back and forth to achieve the best result. Your case. So, we went through tip 1, find good professionals. If I could tell you which one, the tip? The most important tip of this video is tip number 1, because you will find good professionals and won't do things wrong. Doing things wrong makes you have to go back to fix what you did, which shouldn't have been done. Tip number 2. If you are that patient who wonders, will it get better on its own? Then I watched Dr. Thomas's video and I'm going to do everything he said. So, I don't need a doctor, I don't need surgery, don't be mistaken, you need to follow up with a specialist. If your condition is very serious, for example, if your tests indicate that your nerve has been severed, if your foot has no strength to lift, if you've done physical therapy for 2 to 3 months and your condition remains the same, you probably have a more serious injury. And you need a treatment that is not just the use of orthotics and physical therapy. Don't keep postponing a surgery. Surgery is meant to provide you with an improvement. That physical therapy alone will not give you. And what I see is that patients have an accident. Then they see a doctor who doesn't understand, who tells them to do physical therapy for many months, saying it will get better on its own. And then they deceive themselves into thinking that no, it will get better eventually. It's been 6 months, there's no response, but one day I'll wake up and my foot will be lifting. And then this patient waits. Then, when a year passes, they realize it was all for nothing. They're in the same place. They're tired of going to physical therapy. Their money is gone because they spent everything on rehabilitation. And then they seek help and they're tired. They have to undergo surgery. They have to spend on surgery. And they can't stand this dropped foot story anymore. So they give up on the treatment. What I tell you is to enjoy the treatment. If you see that your injury is very severe, the doctor said that it probably won't have a good response. In case you do everything you need to do and you improve. Is 30% of what you have today enough for you to be satisfied? To be able to walk on the beach? To climb stairs? Can you stop using a brace if you improve 30% of what you have today? If the answer is no, maybe you need surgery. Do not postpone this treatment because it will greatly ease your life and improve your outcome. When we talk about surgery, we have nerve decompression surgery and tendon transfer surgery. These 2 procedures, they are invasive, require general anesthesia, are performed in the surgical center, and you stay hospitalized. However, nerve decompression only affects that nerve which is compressed. That patient we mentioned at the beginning, who started losing strength from one day to the next, is an excellent candidate for this surgery, especially if his condition began a few months ago. If your condition is more severe, the nerve was cut or it was very compressed, and several years have passed since your injury, just a decompression will not help because your muscle has already undergone significant atrophy, and there's no point in deceiving yourself. Then I'll do this decompression, and if it doesn't improve, I'll do the tendon transfer later on. And then, if it doesn't improve, I will do an ankle arthrodesis, which is that surgery to insert a screw. So, how long will you wait for treatment to go through all these stages? First, physiotherapy, then nerve decompression, then tendon transfer, then the heel has already contracted, then I'll release the heel, and after that, you'll do ankle arthrodesis. When you realize it, you've done 3 years of physiotherapy, you've had 4 surgeries, and the chance of giving up halfway is very high. And your result turns out poorly. Therefore, if the injury is a bit more severe, a more aggressive treatment leads to an earlier result. And the chance of you giving up is much lower. If you have a severed nerve, compressed very severely for several years if your nerve has been crushed. And you have significant leg atrophy, just decompressing the nerve might be a waste of time. Proceed directly to tendon transfer surgery as well, because it can help you a lot. Guys, so you had the injury. You found a good specialist, did the correct physiotherapy, and there are even videos here on the channel explaining what you can and cannot do during physical exercises for drop foot syndrome. And then you decided to have the surgery. You underwent the procedure with the specialist, learned that your injury is severe, and that just decompressing the nerve wasn't enough, you also needed to transfer the tendon. And there you are in the post-operative phase with your foot in a cast, and you wonder, how long will it take for my foot to return to normal? First of all, the foot rarely returns to normal. It's like a car. If you crash the car, you can take it to the body shop. They will fix the door, straighten it out, but your car has been in an accident. And its door will never be the same as when you first got it from the dealership. The foot is the same way. If you injured your foot and had surgery, it won't return to normal. However, from where you are today, there at home, you can improve a lot. To the point where you might not need to use an orthosis anymore. Or even to the point where you can walk and people won't even notice you had drop foot syndrome. Therefore, follow your treatment. Just because it won't improve 100% to what it was before doesn't mean you can't improve 1000% from where you are today. Post-surgery. Don't forget about rehabilitation. Follow all the instructions from your physiotherapist, because it's not just about removing the cast and starting to walk immediately. You will have to learn to use that tendon you transferred. You will have to learn to lift your foot again as if you were a child learning to walk all over again. All of this will lead you to have a better outcome and better treatment for your drop foot syndrome. Did you find that this video helped you? Well then, a few minutes made a big difference in your treatment of drop foot syndrome, didn't they? So, if you want more information to learn about exercises, about how to ride a bike, about how to work out, about how to use a good orthosis, about how to choose doctors for drop foot syndrome, leave your like and follow my channel, as there will be a lot of information coming over the next few months. See you soon!